Thank you, Devin, and certainly a roller coaster of temperatures right there. But this morning, we're very happy to have Nurse Christina on this morning. Thanks for joining us this morning.
Glad to be here.
Always a pleasure to learn a little bit about nursing the North in the morning. So this week, we're talking about yeast infections.
Yeah.
So generally, talk us a little bit about what is a yeast infection.
Yeah, so we have yeast that live on our body. We have bacteria, we have all kinds of things that live on our skin, and just we all get along really well until something changes,
Yeah,
you
exactly.
know.
Sets it
and
off.
yeah, and so when we get these changes, then the yeast can take that opportunity to grow and flourish, and it causes all kinds of havoc. We can get yeast infections. It can grow in our armpits and in anywhere that can get warm and moist. A foot, an athlete's foot is typically a yeast infection, although there are some bacterial ones too. But behind our knees, and then of course women are plagued with vaginitis that we can get from time to time.
Is there one in the mouth?
There is.
Is that called oral thrush?
Correct. Yep, correct. And so, we can get it in the mouth, you can get it in your esophagus.
Yeah, because I've had some friends, obviously have that, and I was just curious because I was like, oh yeah, I was just like, how about that? Well, we'll go into some symptoms then. So, are there symptoms that people should be on the lookout for when they're looking at this? You say it's typically in the areas
different areas exactly. So for women, when we're affected, we'll have some itching in the vaginal area, soreness, discharge. If it's in the mouth, the thrush, like you talked about, you can have white patches or sometimes redness or sores. It's usually people will say their mouth is really sore, and that then they see the white all over their tongue, and that you can get it in your esophagus. That will make it painful for swallowing. It can get into your system really seriously, and then you're going to have fever, chills, things like that. It can also go into the urinary tract. It can get a form of meningitis that's caused by yeast, although this is very rare. And it can also affect your heart and your skin, as we talked about.
Are there ways to treat it after you've gotten it? Right.
Yes, there are. So one of the things is finding out what causes it and stopping it. So for women, it typically, if we have a urinary tract infection and we get put on antibiotics, that cleans out our system so well that it gives the yeast an opportunity to grow and flourish because we've gotten rid of all the bacteria. And so the same thing, the mouth, it's usually caused by steroid inhalers. Those can, so people who use chronic inhalers, oftentimes the doctor will instruct them to like rinse and spit after they use their inhaler to kind of get that out. But then there are different things. Yeah, we use, the foot creams, the Lotrimin foot cream you can use. For women, there's Monistat, Lotrimin that's given. There's also, for the mouth, they'll give you Nystatin, swish and spit, so you swish it around and spit it out. So there are treatments for these.
Oh, well, that is good to know.
Depending on where it is.
Right. So depending on many different ways you can have it on the body, certainly.
Correct.
So to avoid it altogether, a little bit of preventative practices here, what are we looking at to, avoid getting it in the first place?
So absolutely. One, just keeping yourself clean. When we have moist areas, like between our thigh and our stomach, or underneath the breast, women will sometimes get it. If you're not keeping that dry and clean, that allows that area to grow. Managing stress, so just even changes in like your pH in your body can cause it. And maintaining good oral hygiene. So if you're using those inhalers, make sure that you're doing that, rinsing with water and spitting after you use the inhalers. Treating any conditions like diabetes and cancer and things like that, which can kind of throw off your immune system. So gives these opportunists and the ability to grow and flourish. And yeah, those are just ways. And again, with the feet. Change your socks frequently if you have a job where your feet are going to be moist or wet or exposed to that.
Some good hygiene practices.
Yes,
Certainly.
That's a lot of.
I mean, it makes sense. It makes sense why the kids playing sports in school, athlete's foot,
Yeah.
it makes sense why that could creep up in there.
Yeah. There's opportunities and that's a good point. So it's not necessarily contagious, but it can be if the opportunity and the personal health risks are all there. When it's the perfect storm, you can catch it from someone else, but otherwise it's typically not super contagious.
Well, that is good to know, certainly. As we head into the spring season, I'm sure people will be out and about looking to get active again, and everything's going to be wet, Mel.
Wet and I know, that's what I was thinking too. Yeah, you got to stay dry.
Yeah, absolutely. We'll do our best. Well, thanks for coming on in this morning.
Yeah.
Always appreciate you taking the time, and hopefully we got a
Absolutely.
little bit more knowledge about yeast infections this morning. So coming up, we have what's trending, though.